My name is Okedi Francis Xaviour. I'm a surgical oncologist. I work in a Germany General Hospital. I was recommended to do surgical oncology at Tata Memorial Hospital by the Ministry of Health of Uganda. And it has been a good and a productive idea from the ministry to increase the number of staff trained in management of cancer patients. Some of the most critical things that would greatly improve cancer care in Uganda, I would look at it in two aspects. One of them is the infrastructural bit, and then the other is in relation to the human resource. So generally, like I mentioned earlier, is that we basically have two cancer centers in Uganda. So although the government is really trying its best to make sure that they decentralize cancer management, but still the infrastructure is not well developed, or it's not sufficient for the population of Uganda, which is currently at about 50 million Ugandans. Secondly is the human resource. As per se right now in the northern part of the country, I don't think there are any known surgical oncologists. So I'll be one of the first few to serve in that part of the country. So training of more doctors as well as nurses and other staff involved in management of cancer patients is very critical in this particular case. The Merck Foundation oncology training has come at the right time. Actually, it's one of the things that I would say as a gift that we are getting as a country. Like I said earlier, that we have two main challenges. The first one is infrastructural, the other is in relation to the human resource. So Merck Foundation is actually trying to bridge that gap, which is in relation to the human resource. So we have doctors training in Tata under Merck Foundation, and most of these doctors go back to their initial facilities, initial hospitals where they have been working. So they are decentralizing this service in the country, which is really a plus for Merck Foundation. I would say that to the patient, there will be access to service, access to surgical management of most of these cancer patients, but also there will be the distance traveled by these patients. Like I mentioned earlier, that from most of these upcountry districts to the capital cities, over 100, 500 or 700 kilometers. So if we have a cancer facility within the district hospitals, that shortens the distance these patients have to move to get this service. When joining the program, with a lot of expectations, but the most important I would say was knowledge acquisition. For you to be able to manage these patients, you need exposure, and this fellowship has given me that much exposure that I needed. So exposure to patient numbers, but also acquiring the skills on how to manage these patients has been achieved through this fellowship. So there are mainly two things that I was expecting, or that I wanted to achieve. One of them is knowledge in relation to cancer management, in relation to the different cancer conditions, in relation to how these patients are managed from the time they come in until the time they are discharged. Interestingly, Tata Memorial Hospital has a very unique way of, exposing the doctors. For a surgeon like me, there were about 7 different areas that I went through. My advice to the new students that are joining is that, considering you're going to a different country, it's good to be open-minded. It's good to be open-minded. Of course, you're going to experience a culture shock, but if you are open-minded and very positive of the situation, then definitely I would advise most of them to come in and join if they get an opportunity. It's a very good opportunity that you cannot get anywhere else. India is one of the main referral, or I would say, countries that tend to manage oncology patients. So being in Tata, which is the main cancer hospital in India, and then you train from Tata, I think that is a plus for all the students, because then you're going to be exposed to all the different conditions in the large number of patients. And that will, by the time you leave here, you will not be the same. So please, anyone who is interested, anyone who has much appreciation for our patients, anyone who wants to see these cancer patients recover, please take up the opportunity and join Merck Foundation. But it's very important for all the new students to interact with the residents, the Indian residents or the Indian students that you will be moving along with in each and every department. So if you tag along some of the students, it will be easier for you to adjust and cope up with the system. If you're new in a place, you don't know where a certain department is, but if you tag along some of these residents and fellows already who are native to the country, it will be easy for you to discover and go to all these places. Then also it's important for them to interact with the consultants, which have really done and have benefited a lot. The consultants are very appreciative, and then they're very receptive. So it's good for them to interact with the consultants, interact with the residents, interact with the fellows, especially the natives. They will really find it very easy to fit into the system.